All right. Hi, everyone. My name's Ashlyn, and the topic I'm choosing to talk about today is positions of comfort. So, there are a lot of things that attribute to the painful experience for children. This includes anxiety levels, beliefs and attitudes, past traumatic experiences, the perceived threat of the hospital environment, words they hear, and that are being said that all combine to make up the experience of pain. So, in our role, we have the ability to advocate and develop coping plans that prioritize a patient's comfort and help enhance their coping. So, there are a lot of efforts that we can make on our part to help create a more positive experience for children during painful and invasive procedures and throughout their hospitalization. This is going to hopefully reduce stress, and some of these things include different types of pharmacological pain management. And these are all different depending on what's provided by the certain healthcare setting you're in. But this could include sweeties and pacifiers, topical numbing patches or creams, cold sprays for the skin, and Buzzy in that top left picture, which is a vibrating device that helps alleviate the feeling of pokes for kiddos during procedures. Distraction techniques help provide children with something else that is age appropriate for them to focus on. This can be anything from listening to music, a look and find book, a favorite show, playing an I spy game, blowing bubbles, squeezing a stress ball and taking big deep breaths, counting, or just simply diversional conversation. But it's something they get to choose, which is going to increase their feelings of control. And it can also be something that feels familiar to them in an unfamiliar environment and helps them relax and cope. Lastly, there are comfort positions that we can offer patients and families, and we can implement those during stressful procedures and medical related events. Each of these concepts could serve as their own presentation, but specifically for mine, I'm going to focus on comfort positions. So, a couple of things that are really important to keep in mind and recognize is when it comes to comfort positioning, one is being how kids feel the most vulnerable in a lying down in supine position. If you picture yourself laying flat on a bed, staring at a ceiling, there are strangers above you talking over you. Maybe you can hear like some sort of movement, maybe the sound of medical equipment, but you can't see what's going on. Maybe you can't even see your parent or hear the sound of their voice, and you can't even see what's going on and happening to your own body. We are guaranteed to feel stressed out. So in one of the articles also that I have provided and going to reference throughout the presentation, it shared how when children are instantly held down and placed in this position, they scream in panic and struggle super fiercely. Um, this behavior has always thought of the child as just acting out this way because they're scared and fearful of the procedure itself, but is actually most likely attributing to how when they are forced to lay down in this position, they are immediately placed into the start of a procedure. It is really frightening for them and results in a loss of control. I hear so many times from staff members when the child is laying down like this and they become pretty distressed. The staff member often says, "I'm not doing anything," or "I haven't even touched you, I'm just looking," or "I have nothing in my hands." And that just kind of illustrates how this understanding is really missed in our setting, especially during these invasive procedures. But when a parent is providing a comfort hold, it can really promote a much more positive overall experience for the child and family. So, next, I'm going to provide and share a few common comfort positions. So, the swaddle and snuggle that you can see here is super beneficial and really easy to integrate into a coping plan for procedures. Even if a child does need a little extra help staying still and needs to be wrapped in a blanket, a parent can always lay next to them to comfort them. They can have that close physical contact, and maybe they can even have their other hand free to hold their parent's hand. Another one is back to chest. So this allows the child to sit in a parent's lap, and the caregiver can actually help the child's little legs hold still by wrapping their own legs around them and giving them a hug, kind of securing that other arm as well during procedures. There's also chest to chest. This is when the child is kind of facing the parent and getting that big hug from them. And their attention is typically face the complete opposite direction of the procedure, and they get to focus on some sort of distraction that will help them cope during their procedure as well. Here are a couple additional positions for various other procedures. We can definitely get really creative when it comes to these types of comfort positions and maintain that while also tailoring to the position that the nurse or physician needs to be in for the procedure. Some advantages that I'm going to share and touch on for comfort positions is first, during procedures, this benefits everyone involved, which includes the child, the parent, the staff member, and that's why it's really beneficial and helpful. When a parent is providing a comfort hold and securing the child, it means we don't need to require additional staff members' help to hold the child down. And that in turn provides a larger work area for the staff members as well to perform the procedure. The child's sense of control is regained and they benefit from feelings of security when they're being comforted by their parent because that is their person. In one of the articles, it shared the responses of children ages 5 to 12 years old. They were asked what would help them the most if they were in the worst pain ever. And 99% of them said having their parent present, even though they knew having them there wouldn't actually alleviate the pain from the procedure, was the most beneficial thing for them. In these scenarios, too, parents are also in need of feeling included and that they're a part of their child's healthcare team and experience. And this comfort positioning gives them the opportunity to have a job and role in comforting and supporting their child in a really positive way. So the question I have for everyone is, as child life specialists, what do you think are going to be some of the barriers that we may experience when it comes to advocating for comfort positions? And like I kind of mentioned on this slide, this can be staff related, environment related, whatever comes to mind for you. So I'm excited to hear your guys' responses on that. And I just wanted to share my references. I'm going to include these two articles as a PDF to share with you guys that I referenced throughout this presentation. I'm also going to share a PDF that is a comfort positioning guide that was created by Children's Hospital of Minnesota and a video from Children's Hospital of Colorado, so you can actually see how these different types of comfort holds are utilized during procedures. Thank you so much.